home, support for the person that's living at home. During this class, I'm going to talk about the importance of having help at home. Formal versus informal care, some of the options that are available, and where to find help. I do have to state that, I've done this class for several years at least, and when I was approached about doing it now, I really had to relook at how I presented this class, because some of the information that I would normally be presenting is different than what I will be talking about now, because some of the services are just not as readily available. And so with that, and also sort of filtering the COVID-19 in, because I think it's affected everybody's lives at the present time and how you're approaching things. So just to start out, why is it important to have help at home? So when somebody has Alzheimer's disease or a different type of dementia, they are progressive illnesses. And as they progress, the person's independence is reduced, and they will eventually require more care. And it depends on the stage as to the type of care that they may need. And when I'm working with patients, I'm also working with their families. So it's really a family or their primary caregiver, because sometimes it's a significant other, occasionally it's a close friend, but their support network. So it's important to look at that whole team, or the person that's really on board with them, in order to look at what might be necessary. And with that, needs are very unique based on that particular patient's situation, their family, their care partner, because everybody's situation is different. So when I sort of work with a family, their needs can be very different than the family I may see the next hour. Families have different social support networks in the area. Those social support networks have different levels of commitment and involvement and abilities. People have different income levels and insurances that may be accessible. Sometimes even where people live. We have a lot of people that live in more rural areas. We have people that come down from Payson, where maybe some of the services that we have down here aren't available up there. So a lot of variability that can be addressed. And again, when we're looking at giving support, we're looking maybe at people needing help with physical changes, but also the emotional and behavioral changes can also affect how the illness progresses and what the person and or caregiver may need. So we may have a person with memory loss that has more behavioral changes and perhaps resists assistance from their spouse. Or, I have a gentleman who, was the sweetest person in the world, but now curses at his wife all day long. And by the end of the day, she's just emotionally exhausted. So there's a lot of different reasons that people need assistance. And the next line is very important. Respite is necessary for the primary caregiver. We do not take this lightly, because the primary caregiver, as the person with dementia's independence is being reduced, they have more and more of the responsibilities on their shoulders. And I'm a big advocate for being proactive. I always stress having a backup plan in place before it's needed can be invaluable. Knowing what options are available, and just sort of having that, what if this happens, this is what we could do. Because many times unexpected things happen. I had one November where 2 of my primary caregivers fell off roofs. And they certainly weren't in a situation where they could care for the person that they were caring for. And so different services had to get in place, and it was more emergent. And so if you do have a backup plan, or you thought about other things that could be helpful, it's important to share that with family or the support network so that they know, if this happens, what would we do? So if anybody on has ever met with me a lot, you know that many times I talk about that backup plan. So in this slide, a little bit busy, and I want to focus more on the top part of it, the assistance that's needed. So when somebody has memory changes, different services are needed at different stages of a dementia. So in the very early or mild stage, the person is still having more independence than less. More their brain is working than not. But the executive function, that planning part of the brain and the organizing is a little more impacted. So some of the services and activities and things that they do at home, they may still be able to do, but maybe they're not doing them in the same way. So for example, the woman that was a wonderful cook may be struggling with following recipes or doing meal preparation. So more help may be needed with that. She may have to partner with a spouse. Or maybe the spouse, or she's all of a sudden, I just can't do this anymore, and we have a spouse that's never cooked that's all of a sudden having to learn recipes and such, and that can be more difficult. Housekeeping, the people that were immaculate and taking care of their house might be cluttering more because it's harder for them to throw away mail or to throw away magazines. They may not be as attentive to housekeeping as they were in the past. The person that kept a wonderful lawn and garden may have more trouble with that. It may not be at the same level. Paying bills and finances definitely become more difficult even in the mild stage because it takes a lot of thinking and planning to pay bills. So again, there may be more assistance needed with that. And medications are also a big item in the mild stage because people can be on multiple medications and it's really easy to forget to take them. So, that's where family or caregivers or somebody might need to help with that. Sometimes by using a pill box, and sometimes by providing reminders, and even sometimes by handing the pill to them. When a person moves into the moderate stage of dementia, they're definitely more progressed and they need a lot more structure and routine in their day. And this is where you may see changes in personal care. So they may have more trouble with showering and bathing. So the person that showered every day may say, I just took a shower yesterday. Well, maybe it's been a week. Or they may be very reluctant to get into the shower. Dressing may be more difficult. They may have some physical limitations. So I have people that they can put on the top part of their clothes, but maybe they're not bending as well. Or maybe they're confused about what to put on, or they may, put the same things on every day. So there may need to be more guidance or physical assistance or clothes laid out for them. And even with grooming, sometimes towards the latter part of this stage, the person may need the toothpaste put on the toothbrush and the toothbrush put out, and some assistance with brushing their teeth. They may need some assistance with shaving. I spoke with somebody just recently where the husband, never had difficulty with shaving, but now he forgets to use the shaving cream and will try to shave his face with a razor dry. So she has to put the shaving cream on for him to do that. We may see more incontinence, trouble with bowel and bladder in this stage. So again, this can vary. The person may need to start using adult briefs, or they may need to have frequent trips to the bathroom with a caregiver so that they're not having as many accidents. And when a person is in the advanced stage of dementia, that's really where they're needing help with everything. So you want them to be in a more quiet, comfortable, safe environment. They'll typically need help with all their personal care. They may need help with eating or feeding at times. They're typically having trouble with toileting, so they're probably wearing adult briefs. All their medication has to be given to them. And activities definitely are, in this stage, I'd say, are more sensory because they're really not able to engage in a lot. So it's more sensory stimulation, what feels good to the touch or to the ear, and know that everything is very short. So some of the options for care that we'll go over are some of the informal options, in-home care services, some of the community-based services, but I'd say these have definitely been affected by COVID, and some quality of life programs, which again are different than I would have presented in our previous talk on in-home care, because many of these quality of life programs are virtual now. So again, some of these things have been changed and adapted. But this is a nice little graph that sort of shows the person with Alzheimer's disease or any type of dementia and their care partner. They're sort of at the center. And around them, you have family, friends, neighbors that may be available to help them and provide some assistance. That's sort of your informal care team. And then around that is your more formal care team, which are your medical professionals and some of the community resources that are available. So just sort of a nice little graphic. So starting with informal care, many times this is your first level of assistance that you may be receiving. And people may have informal care and formal care. So informal care many times is assistance from family and friends that are willing and able to assist. And as I have on here, ask for help from families and friends who are willing and able to assist. Right now, I did put in here that for in-person assistance, this may be limited to people who have been socially distancing and or sheltering from their home. Because a lot of the families that I've been talking to in the past few months might have one of their, so it's a couple, they may have one of their children that comes in and provides assistance, but they may not see other children because perhaps they work in the community where they're more exposed to COVID-19. So maybe they're working in retail, or they're working in a store, or they're a healthcare provider in a hospital. So with that, those family members that maybe in the past would have been more available are perhaps distancing. So I think it's important to look at who's coming in and who you're comfortable having help. But many times that is your first line of assistance at home. So I always say, be receptive of offers to help, because many times that whole sense of independence, this is my job, this is my role, I'm the spouse, I signed up for this, or an adult child, I agreed to do this for mom or dad. It's good to be able to have some assistance with that primary role. And and sometimes even people with early memory loss, they want to be independent. And so in order to stay independent, it's very beneficial to have help, because assistance can foster independence when somebody has a dementia. So be receptive of offers to help. You want to identify areas where the people that can assist can best assist. It doesn't always have to be in person. We have a list of different areas where the person can help. Sometimes, if I have a couple and perhaps the husband has the memory loss and he always did the finances and it's really stressful for the wife, many times an adult child can come in and help to manage the finances. And they may not have to be local. They can be in another state and help with that. Sometimes sending in a meal a couple times a week just offload some of those responsibilities from the person who's the primary caregiver that's having to do more and more. I've had some adult children come in and do household chores for family members, because again, it's just one more thing that's difficult. We can have, the primary caregiver may have some physical limitations of their own and may not be able to do all those things. Household chores, yard work, a lot of family members can be available for those things. Sometimes transportation is needed, so family members will be available to take or pick up to doctor's appointments. And then supervision, because if the primary caregiver has to go out to do something, an errand, or even a doctor's appointment, and maybe they don't want or they can't take their person with memory loss, because right now, when you go to the doctors, most of the time you can only be you. If the person can't be left alone, this is when maybe a family member can come in and help to supervise. I always say to be aware of your expectations so you're not disappointed. Many times, family members expect everybody to think the same way. So I've had a lot of meetings with adult children where several of the adult children are just more engaged than others. And, sometimes parents expect more from other people, or even from, siblings of our patient. So we may have older brothers and sisters that just aren't as engaged. And so it's great to ask for help. It's good to give very concrete suggestions about how that person can help. But if they're really not going to do it, you want to be aware of what is realistic for somebody so you're not disappointed. And again, be realistic about your abilities and limitations, because if you may not be able to do everything, and if you're doing so much that you're stressed and overwhelmed, then it can make you sick, and we don't want the primary caregiver getting sick or having issues, because it's so important to be able to keep that role that's so important and helpful for the person with memory loss. So what sorts of things can make your day less stressed? So at the top of my list, I had consider having groceries delivered. And I think when I gave this class in the past, it was probably something that some people did, but maybe not as often. I think more people are using this just because of COVID-19 and not wanting to go to the grocery store. So I think there are a number of services available, whether it's having the groceries delivered, or some people can even go online and just drive to the store and they'll give you your groceries. There are prepared meal programs where they can send a meal to your house and you just sort of put it together. For people that maybe didn't enjoy cooking, or just never cooked and all of a sudden have to, this can be a great thing. And again, just one less stressful thing to have to think about. So I've had children that live in another state enroll a parent in this type of program as a helpful assistance, and they get it arranged and it just comes to the door. And then Meals on Wheels, if you're qualified, can also be an option. I think that although senior centers are closed, many times they're still providing the Meals on Wheel program. Using a mail order pharmacy, so you don't have to go into the pharmacy, and many times then you're getting your medications as a 90-day supply rather than 30 days. So it's just one less thing that you have to think about. And many times with the pharmacies, they just automatically refill it until they need to contact the doctor's office to have the prescription reordered. Having housekeeping services. So again, as more responsibilities are put upon the primary caregiver, what can you unload? So a lot of times we're recommending having somebody come in to clean the house, because it's just one less thing that you have to do, and it can, make it less stressed for you. Or even having yard services coming in, because having to do the bills and the yard and the housekeeping and the meds and the meals, I mean, that's a lot of responsibility. And then the person with memory loss may want some of your attention during all this, and you could be exhausted. So some of those services can be helpful. Sometimes assistance with transportation can make your day less stressed. A family member that can help drive a distance to the doctor's appointment. Especially if driving isn't your thing, or perhaps the person with memory loss was the driver, so to speak, and you're really not comfortable driving. And I do like to mention that these services can be useful when a person has very early stage dementia and they're living alone. It may be a way to help keep them in the home. I know when we first gave this class, one of my colleagues did it, and the question was, well, what if I'm living alone? What services are there for me? And I think, again, having certain services to make the day less stressed and to give additional care can be helpful if somebody's living alone. I do want to mention, though, that a person that has early stage dementia, as it progresses, living alone does become unsafe. So then different circumstances have to be looked at. So again, if you are having family or friends come to help, you want to make sure that they know the best way to interact with your person that has memory changes. So maybe activities that they would have done in the past need to be modified. Maybe they can't play the bridge game the way they used to, but they can still play it for the fun of it. Maybe activities need to be shortened, so they can't do an activity as long because they may feel tired or overwhelmed. And they may actually need ideas of what to do with the person to keep them occupied. So maybe you tell them, maybe you take the jigsaw puzzle out and say, work on this with them. Or maybe there's a music program they like, or some type of easy exercise program. If it was cooler, I'd say maybe they go and take a walk, but let them know where and how far. And you want to plan activities for the person's best time of day. So if you're having a family member come over in the morning, but the person is just waking up and it's really not a good time to interact, you may want to switch that for the afternoon. And then the last few things are I think some of the things we're suggesting now. So you may want to have FaceTime or Zoom meetings to keep connected with family. So before, when we'd say, well, maybe if somebody can take the person out to lunch, I'm not recommending people are going to restaurants now, but maybe you take a ride in the car and just look at something new or different, and you don't necessarily have to get out. Or maybe have a small family gathering in the driveway or backyard where you can maintain like 6 feet apart, so you can still have some connection. So, there's different ways that people are trying to maintain that connection and keep the person engaged. So some of the community resources. So this is the screen from my original presentation, and I will talk about some of these. However, I'm not going to present on senior centers because they are all closed. When I talked with several of them last week, they were telling me they're all closed, we're all in connection with each other, none of them are open, and we don't know when they will open. So that's really the most that I'm going to say about senior centers, but I will speak about in-home care. I'm going to talk a little bit about adult day health centers, although many of them are still closed, and then going over hospice, some safety concerns, and life enrichment is more of the virtual programs that we have in place. So in-home care is really one of the first formal services that people may consider hiring somebody to come and help with, because even in the mild stage, if the primary caregiver needs to go out, or sometimes primary caregivers are adult children and they're working, and being home alone all day is a lot for the person with memory loss. So in-home care can be a few hours a day to 8 hours a day, and it depends on the need or the reason. But definitely some of the first ways of having some assistance. So in-home care can be informal or formal. So informal here is not the same as like asking friends or family. This is where a caregiver may be hired informally. By word of mouth, or it could be somebody that maybe a friend that's done caregiving, and so you know them, you're comfortable with them, you're going to hire them as a caregiver. It could be a personal referral. I've had families that have hired caregivers that cared for somebody else in the family, or a close friend that they know, they feel comfortable with this person, and so they're hiring them on an informal basis, meaning they're not using an agency. So these types of care, you have a consistent caregiver because you have a contract or an arrangement with that person, but one of the dilemmas with that is they may not have a backup. So if something came up with that person, they got sick, they have something that interferes with their caregiving responsibilities, then you may not have somebody to replace them readily. One of the other things that, though, can be an advantage is many times the cost may be less. So you can arrange, what you want to pay them. That's your own agreement. They may be getting a little bit more than if they were with an agency, but it may be less than you would be getting charged with an agency because you don't have that middleman involved. So there's positives and negatives with informal. I certainly don't suggest advertising online to just search for somebody, because you don't know what that person's background is. We've seen unfortunate situations where somebody's just off, hired a caregiver where there's been no screening, and they may not be the most honest person. So again, informal, I would always recommend that you have a reference from a friend or somebody that's had this person in the past, and that can vouch for their credibility. When you hire somebody through a formal agency, that's where, the agency screens the person. There's criteria that they use, which they can review with you when you're contacting the agency. And we do have a list of in-home care agencies that, if you would like that list, you can obtain that when you do your survey. You can just put your email in and what sorts of resources you would like sent to you, and our outreach team will be glad to send you that list. So we do have a list of in-home care agencies. On our list, there's also a website for the state. It's not a state agency, but it's an agency that certifies non-medical in-home care agencies. So there are others that are not on our list, or our list is primarily for Maricopa County. So if you happen to live in another county in Arizona, you can go to that particular area and find some agencies that would be available. The other benefit of an agency is that if you need a backup person, if the primary caregiver that you've hired through that agency is unavailable, they can send in an alternate for you. Sometimes with an agency, though, you may have more than one caregiver. So it may not be a consistent caregiver depending on your needs and the days and what your specific circumstances are. If occasionally I have people that have more than 40 hours, so you definitely need more than one caregiver. But it could be that you maybe have a caregiver that you really like, but they're only available on Tuesdays, but you need somebody on Thursdays, so perhaps Thursdays is a different person because they may have a different obligation. And most of the services for in-home care are non-medical. So they're either a friendly visitor, they're spending time with your person to engage them in activities. They may be there to provide supervision because as a primary caregiver, you need to be out of the house. They may help with errands and chores and different things in the house, easy chores, and they may also be assisting the person with personal care. So, and this is also variable because sometimes a person with memory loss will resist having a family member help them with personal care, but when the quote unquote nursing assistant comes in, they're very open to that. Sometimes it's the exact opposite. So I've heard both. That's hard to say. Again, it depends on the person that you're providing the in-home care for. I always like to mention payment options because many people, when they're first thinking about this, they'll say, well, does my insurance cover in-home care? So I always like to clarify that Medicare and the Medicare Advantage plans like Cigna Medicare, HealthNet, United Healthcare, Advantage Plan, they're all based on Medicare criteria, and Medicare only covers a licensed home care agency that covers intermittent skilled care. So what does that mean? So that means that you really need to have a skilled need that a nurse or typically a physical therapist can provide. So many times when somebody is discharged from the hospital, they may be weaker due to an illness, so maybe they'll get some home health care for physical therapy. Maybe they have some wound care that a nurse needs to come out and help with the dressings. But that's usually, they're in, they're out, they're not there very long, and at some point that ends. Medicare typically doesn't cover supervision at home because a person can't be left alone, help with medications because they're forgetting to take their meds, or just help with cooking and cleaning because they're not able to do that anymore and maybe they're living alone. So Medicare is really more for skilled care needs. However, if a person has long-term care insurance, many times in-home care is a covered benefit. So I always encourage families that if you have long-term care insurance, pull out your policy, read it, look and see what's available. Maybe call and ask, how do I get this activated? What is covered? So the more you're familiar with it, the better. And many times it's good to share this with adult children so that they're familiar with it in case they need to somehow get involved and help with it. Sometimes the VA can cover in-home care services, especially if you're seeing a VA physician and then you see the social worker. Many times in-home care services can be covered. I just spoke with a patient's wife on the phone yesterday, and she said that they have like 30 hours over a certain time period that they're able to get in-home care services that the VA will cover. If a person qualifies for All-Tax, Arizona Long-Term Care, which is the Medicaid program in Arizona, then up to 40 hours of in-home care services can be covered. They never cover 24-hour care. And All-Tax is a a bit of a complicated program. I think it's important that people are aware of this because there is a spousal protection. So some people that are married think I'm going to lose everything, I'm going to lose my house, and that's not the case. We are having an in-service on the 30th of July in the morning with one of our well-known elder law attorneys, Stephanie Bivens, who's going to be talking about all tax and some of the VA programs. So if you want to learn more, certainly feel free to sign up for that class because it should be very good and beneficial. Additionally, look ahead in some of the classes because in planning ahead, when we do those classes, we also talk about all tax and some of the other ways to pay for care in more detail.
Hi, Mary Lou. We did have some questions pop in during your payment options slide.
Yes.
One question is, do you know if Medicare is providing intermittent skilled care during COVID?
I believe so, yes. I have somebody that I just spoke with that's going to be discharged from a rehab facility with home care. So yes, I believe Medicare is providing it in-home skilled care. So again, it's always best to check with the home care agency, and all of those services need a doctor's order. So typically your doctor is going to be sending it into the home health agency, and they should be then letting you know if that is in fact going to happen.
And the other question is, can long-term care insurance be added to at any time?
And the answer to that is no. So if somebody has a diagnosis of dementia, it's going to be very difficult to get long-term care insurance, which is why I said if it's in place, because long-term care insurance is usually purchased when you're in really pretty good health. So a lot of people get that in their maybe 50s, early 60s. If you have a dementia diagnosis and you try to get that, they're probably going to decline you. I've had couples where, a well spouse has gotten it after the spouse has been diagnosed with dementia and they've been turned down. So yeah, and it's not an insurance you want to get when you're in your 80s because the cost would be atrocious. Because long-term care insurance, the cost is increased for your age. So in other words, I have long-term care insurance and so does my husband. We got it at the same time, but my premium is lower because I'm younger than him. And so our premium amount stays the same unless you want to add benefits down the road. And then of course they're very happy to increase your benefit amount. But yes, definitely you want to have it in place before a diagnosis. Okay, so one of the other options for payment is the Area Agency on Aging and the Life Care Respite Program. And I have a slide at the end that gives you the contact information for those programs. But the federal government has some funding for respite care because they feel that caregivers can be stressed and they need respite. So the Area Agency on Aging Respite Program can provide some funding for in-home care. The Life Care Respite Program's funding is definitive. So they may give you $300 and then when it's gone and you don't get any more. The area agency, their program, once you get a certain amount of assistance, you get that until you maybe don't need that service anymore, or if then you get on all tax because you can't have two federal funded programs at the same time. So many times if the Area Agency on Aging has a waiting list, which it frequently does, people might apply with the Life Care Respite Program first and then get on the waiting list for the area agency until that funding is available. But in many situations, in-home care is private pay. If a person is over income for all tax, that's one way to spend, or not over income, over assets for all tax is one way to spend assets down. But many times that's the way people start with in-home care, is on a private pay basis. And the average cost for a home health agency is, I'm going to say, even between $25 and $28 per hour. And again, if you have an informal contract with a person, not with an agency, the payment may be a little bit less. So it's very important to find the right fit. And at the bottom of the page, I mentioned that we have a checklist that can be sent to you again if you put that in your evaluation or your survey. It's called Considerations When Choosing an In-Home Caregiver. And it's just a number of questions that we've put together to help when you're interviewing. And you can, you can have a sheet for each agency you've interviewed, but people don't always know what to ask. But so that checklist gives you some questions that I think can be helpful. But again, there's things, finding the right fit is different for everybody. So, but basically it's very important to know, does the caregiver that they're considering sending over, do they have Alzheimer's or dementia training? Do they know how to interact if the person has behavioral issues, or do they know how to maybe engage rather than ask the person if they want to do something? Because a person may say, no, I don't want to do anything, but if they start an activity with them, they may join in. So, how are they going to know what to do? Do they understand Alzheimer's? You want to make sure that you're being clear on what you want them to do. Are they going to have to cook a meal? Do you want them to do some light housework? Do they have to supervise medication? Now, most of the agencies, because these people are not licensed caregivers, they can't give the medication, but they might be able to put it on the table and then, ask the person to take it. So, you want to be very specific about what activities that you would like them to engage the person with dementia in. I had a family that I spoke with recently that the person just wasn't very social, but they had a caregiver in there so that if they went out, they knew they were safe. So actually the person they had coming in was bringing all sorts of activities, and they were okay with that person just not engaging with the in-home caregiver. And again, expectations can be different. I always tell the story about a family that I had. They were all men. So our patient was a gentleman who lived with his son, and another son lived in town. But the son that he lived with was having some medical issues, and he had to go in frequently for treatments. And the patient of ours, his primary activity all day long was walking his dog. He didn't want to do puzzles. He didn't want to watch TV. He wanted to walk his pit bull. And so they needed to have an in-home caregiver who was comfortable with a pit bull, with a dog, and with taking a walk. So that required a specific type of person. Will they need to transport somebody? Because some agencies allow that and some don't. Again, I have a family that I just spoke with. Our patient's a little bit younger, but was the driver and just was told she couldn't drive. And her husband's more of the caregiver, but he's in his late 90s. And he's not driving. So their home health agency, the primary reason they're in there is to provide transportation. They really don't want help in the home, but they're agreeing to having them come over for transportation. Now, the other piece to that is at least somebody's keeping an eye on them, with the spouse being in his late 90s and having a lot of medical issues. You're going to want to be aware of what hours you want them to work, and that needs to be clear. Do you want to have a male or a female caregiver? Because that can make a big difference. And that varies. Some men prefer to have a female. They don't want a male helping them in the shower. Some females don't want a male. I had a number of years ago a gentleman that was very, very tall. He was a tennis player, and his wife, she just couldn't care for him. And he had a nice, strong male caregiver that could physically assist him, and that worked for them. Are there any language preferences? We have a number of our patients that do not speak English, and if the family needed a caregiver to come in, can they find somebody that speaks their language? Spanish is probably easier because there are a number of Spanish-speaking caregivers, but I have a family where the patient and her husband primarily speak Thai, so it would probably be harder for them to find somebody in this area that spoke that language, or some of the Middle Eastern languages. We have people here that don't speak English, so that makes a big difference. And then sort of getting into what's happening now. Are they being screened for COVID-19? Because I think this is one of the primary concerns that families have about having a caregiver come in. So I know that I spoke with one of the agencies that, is sending caregivers in, and what they were assuring me is that they're really trying to follow the CDC guidelines. And, you can, look at the website that I posted to find more information about that. But, they're making sure that their caregivers are washing their hands frequently, that they're covering their mouth and nose by wearing a mask. So many of the caregivers that are coming into the house are keeping the mask on. Maybe they're wearing gloves if they're doing personal care or doing any contact. They're needing to clean and disinfect any touched surfaces. And of course, if they're sick, they have to stay at home. So again, it's something that people are definitely concerned about. I just spoke with one of my patients' wives who has a caregiver coming in, and she said that, before she comes into the house, they're taking her temperature. I don't think my patient's wife is, but I think she's having the temperature taken before she enters so she can say, I don't have a temperature. So, I believe that the agencies are taking this very seriously. But again, I understand that it is a concern of families. So any questions that you have on this, I'd say ask, and I try to be as forthright as possible about how they're being cautious and preventing and being concerned about this. So it's important to make sure that if you are having somebody come in for in-home care, that it's successful. So a lot of times a person with memory loss doesn't understand the need for somebody to come in. I don't need, and many times I hear the word, I don't need a babysitter. I'm fine. I can be alone. I don't need anybody over here. So if you're thinking that's going to occur, if they're going to be resistant, then I would say don't ask them, do you want to have somebody come over? Because they're probably going to say no. And you may not want to involve them in the planning because that could make them more anxious. They may not understand everything, and it could be too confusing. Sometimes if you get everything in place, then you blame someone else. The doctor ordered this person to come over. I had one woman whose husband didn't think he needed anybody, but he really liked our clinic, and he thought that whatever Banner said was fine. So she just said, well, Banner said that we have to have this person here. And it was fine. Then once he got used to that person coming over, it's great. So many times it takes a bit of time for the person with memory loss to adapt to a change. So I can think of an example where I had a patient of mine coming in with his family, and he was living alone, and the family hired a caregiver, and I think I saw them like the first week, and he was like, I don't like this, and it's uncomfortable. And I've been seeing them for a number of months. Well, he loves this caregiver now. She's the best thing that could happen. The two of them joke, they accommodated to each other. It just took him a while to get used to that person. And now, I think he'd rather sometimes have that caregiver there than his daughters. Sometimes you appeal to the dollar. Well, we have long-term care insurance. We have to use it. So, and now that we're using it, we don't have to pay the premium. So that can certainly be helpful. Sometimes the primary caregiver will say, well, that person's coming in to help me. So, I need help with this or that, and they're coming in to help me. And then once they come in and the person with memory loss gets used to them, they're more comfortable having them there. But it's important that when you present it, you're being positive about it. You're not looking worried or upset, that you're presenting it in a very positive way. And then for the person that's coming in, you need to explain to them what your person is like so that they're able to help them in the best possible way. What are their likes and dislikes? If they're going to be cooking for them, what kind of food do they like? Do they need help getting up and down from a chair? Are they independent with that? What is their activity level? Can they take a walk? Can they not take a walk? Do they need to have a nap in the afternoon? If they fall asleep, it's okay. Some of the background information, so maybe they can talk about it. Yeah, well, you were a physician or you were a teacher. It gives them information that they can talk about with that person, because sometimes being able to relate to them on a personal level can make the person at home feel much more comfortable. And if you've told your person, oh, well, they were sent from Banner, or they were sent by the insurance, then maybe that person needs to use those same words so that they're not sort of breaking your story that you gave them. So, being on the same page with that is important. And just remember, within home care, you're the employer. They work for you. You don't have to hire the first person interview. There's nothing wrong with being particular. And I always tell families, trust your gut. You're gonna feel when that person might connect. And if you hire somebody and you think they would work out and they don't, then you can request another person if you've used an agency. If you've hired on your own, then it might be harder to find somebody else. And it's fine to have expectations. You want to have an activity list. You want to have a chore list. You want to have things for them to do. Maybe you want to observe their first few visits so you can observe the interactions. And if you do need to be out when they're in, you might want to ask, what did you do when I was gone? How did things go? Because again, the more information, the better for you. And it's fine to have expectations. So moving on to adult day health centers. So again, we do also have an adult day health center list that can be provided if you would like this. I can't say that I'm encouraging people now to investigate adult day health centers because many of them are closed. But Oakwood was serving a lot of people in the East Valley, and they have reopened as of a couple weeks ago, but with a smaller group of people. Angel Adult Day Health Center is in Gilbert, and they actually never closed. But they also have they're not accepting a lot of new patients, but I think they are accepting some. So they're open. I believe that the Foundation for Senior Living remains closed. They run several adult day health centers. And Benavia in the West Valley, last I knew, they remain closed. But I think as some of the centers are opening, others may be considering that. So it's always good to check with them if it's something you wanted to consider. So just a little bit about adult day health centers. There, for me, it's like a senior center with supervision and structure. So for people with memory loss, the activities are modified, they're supervised, they're simplified because the goal is to ensure success. It really offers opportunities to socialize and interact with others, which is, I think, what a lot of the people that were going missed, because the person with dementia really enjoyed that social setting, being able to be around other people, but not feel intimidated or that they have to perform. Everything is in a very simplified and modified and a helpful setting. So again, in the past, I'd say attendance could be all day, part of the day, all week, part of the week. I think as Oakwood is reopening, the amount of time that is being spent there is scaled down to a few hours, a couple days a week. But again, if you're looking ahead towards the future, many times I would have adult children that were working and they would have a parent at the adult day health center all week, or even a spouse. If it's a younger onset memory loss person, the spouse that might be working would have the person at the adult day health center all week. So, again, when things get a little bit back to normal, this can be a very beneficial resource. Again, payment options. Medicare does not cover an adult day health center. Some long-term care insurance policies will cover adult day health centers, as well as the VA. So the spouse that I spoke with yesterday, her husband had a couple days covered at the VA, at the adult day health center at Oakwood, and then some in-home respite care. Arizona Long-Term Care will also cover adult day health centers, again, when they're opened and available, and as well as the Area Agency on Aging Caregiver Support Program and the Arizona Caregiver Coalition. They cover some hours. So some of the same funding for in-home care may cover adult day health care. And as I said, with in-home care, many times the adult day health care is private pay. But again, some tips if you are considering using this in the future when the services are more available. Many people go to an adult day health center and they don't remember at all what they did all day because they have short-term memory loss. So, or they may say, oh, I didn't do anything, but they may not remember. So it's always good to ask the staff about their participation, their interactions. It's important to have consistent days so there's a routine. It can take a while for the person to accommodate to the new setting, just like a new person coming into the home can take a bit of time to accommodate. Again, you don't want to ask them, do you want to do this? You want to just engage them. This is a good thing for you to do. You want to talk about it in a positive way. For some people, it's part of their therapy because they're getting brain healthy activities there. Some people go and think they're a volunteer. I've had people that go to adult day health centers and think it's their job. And, the more that they've established it as part of their routine, the more they enjoy it. I usually don't use the words adult day health center to my patient with memory loss. Sometimes calling it a social club sounds a lot nicer. And again, we do have a list of the adult day health centers that are available. And the hope is they'll be opening when some of the social distancing and the virus concerns are lessened. So I think it's always important to be aware of this as an option. I always like to mention hospice as an option to consider, but really when a person is in the advanced stages. Hospice can provide comfort and compassionate care in the later stages of a terminal illness. They really focus on care for the patient and making them comfortable, but also focus on the caregiver and the family's needs. Most hospice services are provided where the person resides. So hospice services come to the home. This is one thing that I always like to say is a Medicare benefit as long as they qualify, and it's under Medicare Part A, so it's covered at 100%. And if you're not sure, there's many hospices that can come out and do an evaluation, and they'll let you know. Palliative care is sort of a pre-hospice benefit. So it's when somebody has more of a chronic advanced illness, but they're not quite meeting hospice criteria. Some insurances cover palliative care. Regular Medicare typically does not, but some of the Medicare Advantage plans will, because they feel that having those extra services in home can be cost effective and keep somebody out of the hospital. Sometimes if a person doesn't qualify for palliative care, though, the hospices may have an outreach program where they'll send a nurse just to check and a social worker, and they can sort of keep an eye on things to know when maybe the person will qualify for hospice. And when a person is on hospice, you have a nurse that comes to the house, you have a social worker, and they can help with the end-of-life decisions. A doctor's available. They'll have typically a chaplain that's available and some respite workers. So it certainly can be very beneficial when you qualify. And again, there's a lot of hospices in Maricopa County. You have the right to pick any hospice you want under Medicare, and you can interview more than one hospice. It does need a doctor's order when services start, but certainly, it doesn't hurt to ask them to come and evaluate. When somebody's at home, safety is always a big issue, which is part of why we talk about in-home care or more services available, so the person isn't at home alone when it may be difficult for them. But I also like to mention the Medical Alert Safe Return bracelet, which is a bracelet that is worn at all times. It doesn't have a monitoring system. It doesn't alarm anybody. But if by chance the person left the house, I have people that are at home with family members that may get up in the middle of the night and walk down the street. We may have a person, maybe the primary caregiver is in the backyard and the person slips out the front door. Those things can happen. So a medical, or you may take them shopping and they may wander and get lost because you think maybe they're sitting in the front like you asked them to and they're not waiting anymore. So the Medical Alert bracelet has an 800 number on it. It doesn't have the name and address, but if somebody were to become lost or wander, then if somebody found them, they will call the 800 number, and then the operator at the end of that 800 number would then call family to say, we have found your person. So it's just a nice proactive resource. Many times caregivers wear the bracelet because if there is a caregiver that's going out to do errands and maybe the patient with memory loss is home alone and they got in an accident, it would identify them as a caregiver. And, could you imagine the person at home that, all of a sudden their spouse has been gone for 5 or 6 hours and they don't know where they're at because maybe they are in the emergency room. It would identify them as a caregiver for somebody at home with memory loss, and other family members would be contacted. So I have a lot of couples that both wear the bracelet, and sometimes if the primary caregiver wears the bracelet, then the person with memory loss is more agreeable to do that. So I have the website on here, medicalalert.org, and their 800 number, but the Mesa Police Department has a program that's funded to also help provide this at no cost. So if you get on the website, on the link that I provided, you can fill out the information and send it in, and they can also help provide that bracelet. So here I'd be probably talking about some of our life enrichment programs, which are which Banner Alzheimer's Institute has partnered with, and there were a number of community programs available, but now I'm really focusing more on virtual programs that help keep the person occupied. One of the ones that I've given out to a lot of family members is through the Alzheimer's Foundation of America. And if you go onto their website and scroll to the bottom of their page, they have their calendar, and they have a different program, or sometimes more than one, every day. So I've signed up for their newsletter, and they send me these programs every week. But they have, usually every week, they have a different type of music program. They have somebody that's leading an art program or an art class. They have different exercise. They have like disco jazz chair exercise, or yoga chair exercise, or, they're trying to be very creative. But beyond that, they may have a virtual tour of a museum. They may have a virtual tour of a trip to another country. They may have a jazz concert. So they're really trying to vary it up. So it's another way that if you're at home and your person's not able to get out to do some of the things they enjoyed, maybe then they can have some of these programs at home that they can listen to or engage with. The Foundation for Senior Living that does have some adult day health centers that are closed has a number of video resources. So they have a variety of chair exercise classes that you can click on and watch. They have music. They have some different art programs. When I looked on there, they had some virtual outings and some cooking videos. So again, depending on what your person enjoyed, it's something that you can look at together. And also Benevilla, who again, they have a number of adult day health centers in the West Valley that are closed. They have some virtual enrichment activities. And when I looked on there, again, it was music, trivia, crafts, exercise. So there's a variety of options, and I'm sure there's a lot more options than I even have on here. I know Ballet Arizona, they're putting ballet performances online because people aren't able to go and watch their ballet performances. So for people that really enjoyed the arts like that, if you get on their website, you can probably find or be notified when they have ballet performances that they're streaming. The City of Surprise, they're on a fairly new memory cafe that Banner partnered with, and they now have call-in sessions, and they're the second and fourth Tuesday of each month. So the call number is there with the conference ID. That might be something that can be participated in. Our Banner Alzheimer's Institute has a number of virtual programs. Shine Your Light Chorus happens every Friday from 10 to 11:30, and people are singing, and it's on a platform where everybody can see each other. It's a virtual platform where you can see each other, so people are enjoying that. Every Wednesday at 9:30, we host a happy half hour. And the goal is to have connections and ideas to stay engaged and purposeful. So they have different discussions every Wednesday. So I don't know what they are. It's sort of a surprise, but I think that can be, something that you can join with your person with memory loss, and it may be something that you will both enjoy. We had a Passport to Music program that we did about, I think, 4 or 5 sessions at the Musical Instrument Museum, but of course that was stopped. But we did start a virtual session for this. So it was a 6-week series where they explored music from different areas of the world in the comfort of your home. So right now, the series that they have is ending, but I think if you sign up for our Beacon newsletter, and you can do that by going on to banneralz.org, you scroll to the very bottom of that front page, and you can see sign up for the Beacon newsletter. And it's coming out every 2 weeks now, more frequently than in the past. And, there'll be different different links to some of the programs we have available. So I'm thinking that they'll probably repeat the Passport to Music, and if so, it'll be announced in our Beacon newsletter. And to sign up for any of these programs or ask any questions, you can either call the 839-6918 number or email BAIFCS, and our outreach staff will be glad to guide you through what's available or register you for something that we already have in place. And then again, as I was saying before, the places to find some help, for example, with the Caregiver Respite Program, that's through the Area Agency on Aging. You call the senior helpline and say, I'd like to sign up for the Caregiver Respite Program, and they'll let you know if they have funding available for some help in the home. The Alzheimer's Association, they have a lot of information online about upcoming programs and events and different services that are available. The Arizona Caregiver Coalition, they can sometimes be the service in place before the Caregiver Respite Programs of the Area Agency on Aging. So their website and phone number is there. We have a number of lists that I had said that talk about some of the different programs and services available. So, feel free to reach out to our outreach workers for that information. And for some of the options on how to pay for care, I would encourage you to attend the upcoming Arizona Long-Term Care class with our elder law attorney, or watch for a future Planning Ahead class where we talk more about options for care. I also just want to briefly mention volunteer agencies. I think that perhaps they're scaling down some of their services due to COVID-19, but I think some of the services are still available. So they're really based on where you live. Neighbors Who Care is very big in Sun Lakes, whereas Duet is more Phoenix, Fountain Hills, the Central Valley. Benavia is more the Northwest Valley. The Foothills Caring Corps is very, very far north. North Scottsdale, Carefree, Cave Creek. So, the volunteer agencies can do a number of different things. Sometimes they provide transportation. Sometimes they'll do shopping. They may provide some companion care, but I'm thinking that might be a little bit less now. But I don't think it's a bad idea to be aware of what volunteer agencies are in your neighborhood, what they can provide, and if they could be of benefit to you. We do have a volunteer agency list that actually has their websites. We have the phone numbers on here, but or you can Google the name of the agency and look up their website to see what services they're providing. But volunteer agencies can be another resource for help. So with that, I'd be glad to answer any questions you may have.
Thank you, Mary Lou. We haven't had any questions come through since your one slide, but
Okay.
we do encourage everybody, if you would like to ask your question in person, you can unmute yourself or utilize our conversation box, and you can submit your question that way. We can facilitate that, and I can send that over to Mary Lou as well. My colleague has put in some of our programs that we are going to be facilitating, like our Altex and VA benefits, as well as a survey. If you can please fill out our survey, that is where you can request any one of our resources that Mary Lou has talked about in the presentation. These answers do stay anonymous, so please, there's a section other comments, if you can put what resource you specifically would like, and then just put your first name and first letter of your last name in there, then we'd be able to know who to get in contact with and what resource that you are looking for.
Hello, I have a question. Can you hear me?
Yes.
Yes.
Oh, my name is Sherry, and thank you for taking this question. You've talked a lot about it's all about safety and comfort. I am faced with my dad is the caregiver. My mom has probably moderate to advanced dementia.
Mm-hmm.
Dad doesn't like care help. He lets family come in, but we can't always be there for him. So when he and Mom go shopping, if it's raining or if it's hot, he leaves her in the car with the car running, which I do not think is safe. So what criteria could you help me talk to him about as far as keeping her safe and away from risky situations like that?
Well, my concern with her being in the car is if she got impatient and wondered where he was, she could get up and wander away.
Yes, exactly. I've told him that.
And somebody could get in the car and take it. I mean,
I think she locked it, but she could unlock it easily. Yeah.
Oh, exactly. You know, because this is the thing. If she's more moderate, her judgment's impaired. Somebody could knock on the window and she could just open the door, which would probably unlock the car.
It would, and she would be very kind to do that. That's a very good example. I hadn't thought of that one.
Right, because, you know, again, she's living in the moment. She's not thinking, oh, who's that person? She could, you know, who knows? So, I mean, you know, he really should take her in with him or have somebody come and stay with her because, you know, I mean, you might say, what if that did happen, Dad, and they took Mom? Because, you know, they take cars with babies in it, right? I mean, I haven't heard of somebody taking an adult, but you never know. And, you know, there's people that aren't very trustworthy nowadays. So how would he feel? He would probably feel horrible.
Yes.
And horribly guilty. So I would say, you know, and sometimes you can say, I just read this. Maybe you can say, I just read that happened. That might scare him a little bit. Not that you want to scare him, but, you know, sometimes you got to look at what might make him take action.
Yeah, I do want to scare him, actually, because he's way too blasé.
So, you know, everything is online nowadays. Does he get online and read the news?
He does. He's pretty up on the news, and he does watch crime, but he feels that he's reached that age where his judgment is a bit impaired. His faculties are there, but he's not making good choices, in my opinion, and probably for the last 3 years. He's not making really sound choices. Right.
And the reality is, if your mom did wander away and the police were called, then you know, they might call Adult Protective Services because they'll say he wasn't supervising her.
That's another good one.
You could mention that, and then the state's not going to take her away because, like children, they take away, the state can't do that, but he doesn't need to know that if you're trying to, you know, make a point.
Right. Yeah.
I mean, you know, I'm the first one to try to be open and honest and try to be logical, but when somebody can't be logical, then sometimes you have to go through the back door. Because the main concern that you have is your mom's safety.
Exactly, and that's
you're
focus,
doing the right thing.
I always say that to him. I really liked your example of getting matching caregiver and
the bracelets.
Person bracelets. I think I'm going to give them those for Christmas.
Good. You know, a lot of people wear those. It's just a nice safety precaution, and many people have had to use them, so we really like that option. So
thank you, and thank you for this seminar. This has been very informative. I really appreciate your time.
Oh, you're welcome. You're very welcome. Thank you for attending.
We did have another question come through, Mary Lou. How to inform parents that they should not drive anymore?
That's a great question. Sometimes that takes a whole class to talk about that. So if it's the person with memory loss, a lot of times the most effective way is to let the doctor say that. So then it becomes the doctor said you can't drive. What am I supposed to do? We have to do what the doctor says. So you're sort of the sympathetic person and the doctor is the bad guy. And I know at our clinic, our doctors don't mind being the bad guy. Sometimes our doctors will recommend a formal driving evaluation with an occupational therapist, and they can really look at the strengths and weaknesses and the ability to drive. So then it becomes, they gave the recommendation that you can't drive. And, they do here in Arizona, they send it to the MVD, I believe. So that's another way. Sometimes, it depends on your circumstance. Some family members disable the car, or they take it away, and it's like, it's in the garage, and they keep it in the garage for 2 or 3 weeks or a month or 2. Or, a family member needed to borrow the car because theirs isn't working and they got to get to work. A lot of different circumstances. We actually did a whole in-service on driving. And I don't know if we have anything coming up this year, but there's a guide put out by the Hartford for driving and dementia that has a lot of good tips in there. So that's another resource to look at. And if you wanted that, I know that we do have that as a resource. So you can put that on your survey and ask for that information, because there's a lot of good tips in that book on driving with dementia. So hopefully that was helpful.
We also had another comment, Mary Lou. Somebody is looking for any kind of agency or resources in Oro Valley or North Tucson that you might know of.
So what I would do, hold on, I've got to find my list over here. If you look at the website is aznha.org. So it's AZ like Arizona.
Sorry, I didn't catch that.
For some reason, Siri thinks I'm talking to it. So it's AZ, N like in Nancy, H like in Harry, A like in Apple.org. They have a lot of agencies based on your area. So if you go to that website, you can put in your area and they should be able to give you some options. And is Oro Valley near Tucson? Do you know, Chase?
I believe Oro Valley is it's North Tucson.
And the reason I'm saying that is we do have a clinic in Tucson, so they may have a list of agencies that serve that area. So again, you may want to add that to the survey. If there's a list of agencies in the Tucson area, that may have agencies in Oro Valley. But personally, I'm not familiar with any. I apologize.
Yeah, the person responded saying that Oro Valley is northwest of Tucson.
Right. So that agency, if you put in the zip code or the area, they may have some agencies, or perhaps our list from some of the resources in Tucson may have that. So perhaps if you put that in your survey, our outreach team will be glad to look on our resource list for Tucson and see if we have that information.
Thank you, Mary Lou. So far, it looks like no other questions have come in through the chat. If there's anybody else online right now that would like to unmute themselves and ask a question verbally to Mary Lou, we can stay on for a couple more minutes.